Hello, and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a certified family nurse practitioner and a certified nurse midwife in Santa Fe, New Mexico. I own and operate EverCare Family Practice, where I specialize in family health care, bioidentical, as well as FDA-approved hormone replacement therapy, and in aesthetics. I appreciate you joining me for the podcast today, and I would like to do a second part and a conclusion to the podcast done last week on low testosterone for men and on testosterone replacement options. Last week I discussed many different things regarding testosterone and men, but just did a brief little synopsis on treatment options due to time constraints, and that podcast was becoming fairly long. So I thought I would delve more in depth on testosterone replacement options for men, as there are several. One that most men know about are the injections, and that's the testosterone cypionate. This is an injectable form that's either given intramuscularly or underneath the skin. It is FDA approved and often paid for by the insurance company for men, and it is given usually every 2 to 4 weeks. And the dosing for the injection is based on the individual's levels of testosterone in the testing. So there are other types of testosterone injectables as well, not just the cypionate. There are 2 other forms, and again, those can be given. Most of them are every 2 to 4 weeks. One of them will start out every 4 weeks, and then you go to every 10 weeks. One of the reasons that men like this form of testosterone replacement is that it is covered by their insurance. One of the downfalls is that it is an injection that's done anywhere from, some men get it every week, some men get it every 4 weeks. Most of the time they do that at home, and oftentimes they do have difficulty over time with doing the injections for themselves. It can become painful. So that's one of the complaints that I see. Also, there is a potential for the binders in the testosterone to cause a little bit more aggression. And so men do need to be careful if they are using that form of testosterone replacement. Another type of replacement is a testosterone gel. There are several gels that are available on the market. They're given via prescription by the person's provider, and the gels are usually put on every day. Most of the time they'll be put on in the morning, and they're very easy to use. However, some of the pitfalls for this type of replacement therapy is that the patient has to be extremely careful that no one else in the household is exposed to this type of testosterone. So there's a lot of cleaning that's involved in making sure that there's no cross-contamination from the patient's hand onto objects that may be encountered by other household members, such as sink handles or toilet handles, or the handles on the drawers that you pull out in the bathroom. So that can be one of the reasons why men don't like to use this form. It has to be done every day, and you do have to be very careful with it. However, it is easy. It's applied at home, and when the man remembers to do it every morning, then there is usually no difficulty with that form. With the gels, we'll talk about next the testosterone patches. There are several patches that are available. The patches are usually put on every night between 8 p.m. and midnight, and they're left in place for 24 hours. After the 24-hour period of time, the testosterone patch is usually removed and another patch is applied. Now again, this type of hormone replacement therapy is fairly easy. You just have to remember to put a patch on every night, and the patient is instructed to make sure they take that patch off after the 24 hours and put another one on. You can't just leave the other patch on and put another one on top. One of the possible side effects is obviously having a sensitivity to the adhesive that allows the patch to stay in place. So people with sensitive skin may have a little bit of a difficult time using that form. 2 other things to consider with the gels as well as the patches is the absorption. Everybody absorbs medication differently. So some men may absorb this very well and have high testosterone levels, where other men may not absorb it as well and not to get the benefits of that type of therapy. Another form of testosterone replacement that a lot of men don't know about, I think a lot do, but sometimes in my practice they'll be surprised to hear that there is a nasal spray that you can use. It's actually a gel that goes into the nostril 3 times a day. So you would put the dosage into the nostril, each nostril 3 times daily, and usually the patient will be told to space those doses out to every 6 to 8 hours. Now this is an effective form for delivery as far as absorption of testosterone, although it is something that does have to be done multiple times a day, and again, it needs to be kept away from anybody else in the household. Some of the side effects associated with this would be anything that is put in the nose has the ability to irritate the nasal mucosa, which can increase nosebleeds to a degree, can also possibly cause headaches, dry nasal mucosa, and there's always the potential for increase in nasal discharge, and the gel is not being uptaken appropriately. And again, it is very individual on how men are going to uptake something that's given intranasally. Some may uptake it very well and have high levels, while some may not get the full benefits. Other forms of hormone replacement therapy that we'll talk about next are the bioidentical. So bioidentical I do use a lot of in this practice, and you can use bioidentical creams that can go on to the skin that are formulated by a compound pharmacy. Again, with testosterone, you do have to be careful that no one else in the household is becoming in contact with this bioidentical cream, and it does have to be put on twice a day. It can be put on in the areas of the lower arms, you can put it on the thighs, you can put it on the buttocks, but you do have to put it on twice a day due to the half-life of the medication. The other possible downfall is we don't know how men are going to absorb it until they've tried it. Some may absorb it wonderfully, some may not. It just depends on their individual bodies. Another type of bioidentical hormone replacement for men is called a troche, and that's spelled Troche. And the troche, again, is also bioidentical. It is formulated by a compounding pharmacy, and the troche goes in between the gum and the cheek where it is left to dissolve, and there's specific directions that the pharmacy will give the person. It can be formulated with a flavor, so that makes it nice for the person to use, but it does again have to be done twice a day. Some of the complaints that I get regarding the troches is that it takes them a while to dissolve, and they're told not to swallow the saliva. Now, I haven't heard that too much, but that is something that a lot of men don't want to do. A lot of men do get very good absorption through this form of therapy, and it does tend to work very well for most people, bringing their testosterone level up to an optimized state. However, it is done twice a day. With all of the testosterone replacement that we've just talked about, the one downfall is that there is a half-life in every single form that we've just mentioned. So the injections have a half-life, the nasal gel has a half-life, the topical gel, solutions, patches, and the troches, as well as the bioidentical creams, all have half-lives. So that means when you are using the medication, initially you're getting a spike in your level, and then over time that level in your system starts to go down, which is why you have to do it again, either every day or twice a day or every 2 weeks or every 4 weeks or even every 10 weeks. You're still getting that half-life where it has to be replenished. It's wearing off, and your levels are going back down again. The hormone replacement with bioidentical pellets, they do not have a half-life. And so there are many different types of bioidentical implantable pellets that you can use. I happen to be a provider for BioT, and I like that form of hormone replacement therapy. I think it's very effective. I like the fact that it is formulated in the pharmacy and that they have a very tight range of their pellets being inspected, and a 10%, they don't go over 10% either way on their dosage, whereas other pellets that may be formulated at other places may be have more than a 10% leeway, and that can give people, when you put the pellets in, they may not be getting the same dose that they got on the last dose, whereas BioTE is very careful in the way that they formulate their pellets. Now these pellets are nice, as well as very easy to insert, but one reason I like them, and one reason that I am on pellets myself, even though I'm not on a man's dose of testosterone, but the nice thing about these pellets is there's no type of binder holding the testosterone together. So when you're using gel, or you're doing an injection, or you're using a patch, or you're using a troche, or you're using a cream, there is a binder that is holding that testosterone into place to be absorbed into your system, however the method is going to be. With BioTE pellets, there is no binder. These pellets are held together with 10,000 pounds of pressure, so it is pure 100% bioidentical hormone, which I think is really important because there's no competition for binding with the type of binder that's being used to hold the medication into place. There's also less risk for any type of side effects or allergic reaction, because sometimes people will be allergic to whatever that binder is that's holding that medication in place. So that's why BioTE for me is an option that works really well in my practice, and we do have a lot of patients who are on these pellets. The other nice thing about these pellets, bioidentical pellets, is there is no half-life to the pellet. It is absorbed based on the person's cardiac output. So the more activity the person is doing, the faster they're going to burn through the pellets. The least activity, or the littler the activity is, then they're not going to burn through the pellets as fast. Now we want people to be active, and that just simply means that they may need their pellets a little bit more frequently. But on average, bioidentical pellets from BioTE are placed every 3 to 6 months. The blood work is drawn, it's put into a computer system that gives us an algorithm of what is recommended for hormone replacement, and then based on the individual, that dose can be adjusted. And there's also many, many different options as far as dosing. There's not a 3-dose regimen, because there is an implantable pellet that is FDA approved, but there's only 3 different dosing options, and oftentimes that's not going to be adequate for treating somebody who's individual. We are not made out of cookie cutters. We are individuals, and our levels are all going to be different, which is what is nice about implantable pellets. The pellets are placed fairly easily. There's just a little incision that's made after the patient is numbed up, and the trocar is inserted into the subcutaneous tissue, and the pellets are individually placed into the trocar basket and inserted. So the whole procedure may take about maybe 5 minutes to put the pellets in. Sometimes it's a lot faster, sometimes it takes a minute or so. It just depends on the person. It depends on the number of pellets being used, and on the area that they're being placed. Most of the pellets are placed into the subcutaneous fat of the buttock. You can place them into the lower abdominal area, into the fatty tissue, but the majority of cases that I'm aware of are usually into the subcutaneous fat of the buttock. So the patient is given instructions on not doing any heavy gluteal activity on that side for approximately 7 days. They do have to wait a bit to take a shower. Usually it's about 24 hours. The steri strip should stay on for about 7 days, and then we just have people stay off of, as much as possible, unless it's medically indicated, blood thinners, and they can take a Tylenol for any discomfort. The follow-up is usually done in a month, and to determine how the person is responding to the pellets. And then blood draws are based individually on, based on how the person is doing, how they're feeling, when their last dose of testosterone was, how many pellets they've had in the past. So it's very individualized for these people. And it is a very popular form of treatment. So those are your basic treatment options. There are, of course, other things that people try for testosterone replacement. Some people try dietary changes. There are some over-the-counter commercials that people see on testosterone enhancement, which people try. We're not going to get into those because they're not something that is necessarily FDA regulated at all, and it's based on personal preference. If you should have any questions regarding testosterone replacement, you can feel free to contact us at evercarefamilypractice.com or our email, which is evercarefamilypractice@gmail.com. On Facebook, Instagram, you can call our office at 505-780-8301. We would love to hear from you. I always encourage any questions or comments. I would absolutely love to discuss any questions you have further, and I would like to thank everyone for joining me today for this brief podcast just to go over some of the treatment options in a little bit more detail. I'd like to thank Brad F. and Kathy V. I'd like to thank Colleen as well as Samantha and Angelina. And also I would like to thank Mark and all of our listeners from California, Pennsylvania, Texas, New Mexico, India, and wherever you're listening from. I really appreciate you taking the time to listen to the podcast, and I hope you have a wonderful rest of your day. Thank you.